Hello and welcome to this author interview. This is Howard Bauchner, Editor-in-Chief of JAMA. As many of you know, who've listened to these podcasts before, I've been fortunate to interview Dr. Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases. And today I'm interviewing Zunyou Wu, who is the Chief Epidemiologist at the China Centers for Disease Control. Welcome, Zunyou.
Thank you.
Thank you so much for joining me. I think our listeners are really quite anxious to hear from you. But before we start, firstly, on behalf of JAMA, the United States, and I think most of the world, I hope you and your colleagues in China are doing well. I know it's been an extraordinarily difficult time the last few months, and I'm quite sure you're working virtually every day, very long hours. So I wish you and your colleagues the best. Could you tell our listeners, Zunyou, where you trained and what you currently do?
Okay. My name is Zunyou Wu from China CDC. I was trained in the University of California at Los Angeles with a PhD degree in 1995. After coming back to China, so I primarily work on HIV/AIDS. Also, when the emerging infectious diseases come in, I also join the fight for this epidemic. For example, in 2003, so I joined the anti-epidemic for SARS, for this coronavirus. So I joined in the middle of January. So my role is to try to collecting data, the individual cases, and try to use epidemiology analysis, look at the pattern and the trend of the epidemic, try to interpret the result and give guidance what's the most important to address the issue.
Well, I think the United States and other countries have a great deal to learn from what's been going on in China. So I'll ask a number of questions. But before we get to the questions, Zunyou, can you tell me, as of today, which is February 13th, and for me it's 8:30 in the morning. For you, it's 10:30 or 11 p.m. at night, February 13th. What are the number of cases that are currently now been reported in China and the number of deaths? The number of cases outside of China is actually quite small, but what are the number of cases in China?
So we collecting data every day by the midnight. So we download data from our national reporting system. We do analysis and submit a report to the National Health Commission. So now I have data available at my hand as of February 10th, 2020. So that was 2 days ago. So by the February 10th, we have totally reported 42,638 confirmed cases, reported 1,016 deaths. And also we have 21,675 suspected cases.
As you know, because I know you participated in a number of discussions, some interesting discussion has occurred about the definition that the CDC in China is using. So you just indicated there's about 43,000 cases. But then you also just indicated that there's approximately 21,000 other designations. What is the 21,000?
It's suspected cases. So that means there has not been diagnosed as a confirmed case yet.
And are those individuals who have symptoms and don't have symptoms and have had diagnostic testing, or are those individuals who've had diagnostic testing but have not developed any symptoms? Or is it both?
Most of these suspected cases, they do have the clinical symptoms, but do not have the laboratory test yet, because the capacity to provide timely laboratory test is insufficient, particularly in Hubei, Wuhan. So we try to support capacity in the Hubei province. So central government sent many health workers, including lab technicians, to Hubei and Wuhan, try to address that issue.
So I do appreciate it. Just the capacity to do a massive or a large number of diagnostic testing is just limited, as it would be in any country.
Right.
Can you say a bit about? I mean, you're a trained epidemiologist. You've done remarkable work. Can you tell me what your sense is of the epidemic in China over the last week or 2 weeks? Do you have a sense of what you think is occurring?
So if we look at the epidemic, we have two important indicators. So for each individual cases, they do have two dates. One is the onset of symptoms, one is the date of reporting. So the public, they only knows how many people being reported, and also the government announced it's the number of people being reported. So what we do, so for each individual, we have the epidemiological investigation, try to understand what's the onset of the illness. So we use that data to reconstruct the epidemic curve. Based on that, so the epidemic curve peaked in the January 23rd to 26th. But for most people in the general public, they cannot see that. Only we analyze the data can present that way. So the epidemic now it's actually going down. That is because we have the very strict control measures.
So it's
also we have. Sorry.
No, go ahead. You finish your sentence. I apologize. Once you finish your.
So because we also have the Spring Festival, people stay at home that isolate or reduce people movement. After that long holiday, people coming to work. So the future direction of epidemic is still uncertain yet. So we prepare possible upcoming epidemic.
But it sounds like your sense from looking at data on a daily basis and the investigations that you've been able to do is that actually the epidemic is improving, not getting worse. Is that I want to make sure I understand what you just said.
That's correct. So they have two broad patterns of epidemic. One is in Hubei and Wuhan City. That epidemic is different from the rest of the country.
Okay.
Yeah. So outside of Hubei, it's mainly originated from Hubei. Then they do have secondary transmission. Most are clustered at a family. Does not spread to the community. So the epidemic are going down both based on the onset of illness and also based on the reporting of dates. However, in Hubei and Wuhan, the epidemic is still very complicated because the number of people infected are huge. So the medical treatment and diagnosis capacity cannot absorb.
Yeah.
So in the recent days, you can see larger number of reported cases continue to increase, also not stable. So that makes the interpretation very difficult for people outside.
Do you have a sense, if you just look at the numbers, it's 43,000 or so and 1,000 deaths, that gives you a case fatality rate of 2 to 3%. But some people have projected that it's actually much lower because there's likely many other people who are infected who haven't either come for medical attention or aren't yet defined as having been infected. Do you have a sense of what you think the case fatality rate actually is?
Right now, the case fatality, it's as you just said, about 2%. It was overestimated because they do have asymptomatic cases. Also, if we compare the mortality in Hubei, Wuhan, and outside of Hubei, Wuhan. So in the other provinces, the mortality it's about 1%.
Right, and if I'm not mistaken, in Hubei, there's about 32,000 cases, and there's about 10,000 cases in the rest of China. Is that accurate? I think those are the numbers I looked up this morning.
In the Hubei, it accounted for about 90% of total cases in China.
It's 90% in Hubei. Okay, so about 10% of the 42,000 cases, or about 500 cases, are outside of Hubei. So the majority, as you said, 90% are in Hubei. There's been
70%.
70%. So 70% of the 42,000 is about 30,000. So there'd be about 10,000 cases outside. And you said the case fatality rate outside of that area is lower.
Yes.
Now, there's been some discussion about asymptomatic communication of the disease, and defining an asymptomatic state is quite complicated. Part of it is in the case series that JAMA published, many people had unusual symptoms, diarrhea, for example, or GI upset, which isn't usually associated with respiratory pathogens. So I think defining an asymptomatic state is not easy. What's your sense about asymptomatic communication of the disease or spread of the disease? Do you think it's real or it's still uncertain?
I think our understanding about the spectrum for coronavirus is still continuing to increase. So in the early stage, we do not believe that there were asymptomatic cases. However, with more people being tested, we do observe certain number of people they tested PCR positive, but with no any symptoms. So the most common symptoms we observed, it's a fever, dry cough, and fatigue. Also, some have diarrhea. So for the asymptomatic cases, they have no these symptoms at all. However, we do not know if really they are virus carrier or it's in the early stage. They may, with the time moving, they will develop symptomatic cases or diagnosis cases. So we still need to observe the asymptomatic cases for a certain period of time.
Now,
so the study is ongoing.
Yeah. Now, the other issue that's come up, and we're about to publish a research letter in the next day or so. Today's Thursday. I think we're publishing it tomorrow, about a case series in infants, children under the age of 1. There had been initial reports that it seemed as though infants and children were being spared, but I don't think that's the case. Do you, in the data that you get, can you look at the age spectrum of those people? The 42-odd thousand is. Can you see disease in infants and young children?
Yeah, we do. We have very, very small number. In the early stage, because the exposure is in the food market. For the food market, it's many adults there. So if we look at age distribution, majority are young adult. So let me look at this figure. For people aged 30 to 79, that accounted for 90%. Okay. 90% of total cases. So the children is limited number because their exposure, the opportunity to be exposed is small. So it's mainly after the virus spread outside Hubei, then the more cases for children were reported.
Now, is there anything emerging yet on treatment? Most of the case series, when we publish, that have been in other journals, have really been symptomatic for those, particularly those older adults with comorbid conditions who are quite ill. It's mostly been symptomatic. You know, people have tried some antiviral, some antimicrobial agents. Corticosteroids have been reported to be used, some HIV drugs. Is anything emerging around treatment, or is it too early, or it's still too uncertain to really be definitive about treatment other than supportive care?
Right now, it's more supportive of care, and doctors try every effort they could. For example, one of medicine treat HIV called Clipro, and they used, and the patient themselves feel good. So one doctor, he suffered with the coronavirus because he's doctor, and he knows the Clipro can be effective for the MERS. Then he took the medicine, then he shared his experience. Right now in China, we do have the clinical trial to test one of medicine still not in the market yet. It's developed by Gilead. It's Desavir. I forgot the name.
Okay.
Yeah. It's a new medicine, has not been marketed yet, but it's very effective based on the vitro.
And that's being tested in a clinical trial?
Yeah, in a clinical trial. Gilead provide 800 dosage for the clinical trial. The trial already ongoing for about a week now.
And is it for individuals who are quite ill in the intensive care unit, or is it general population? Who's eligible to be in the trial?
It's in the hospitalized
patients.
Right.
And
that's correct.
Is there a control group or a placebo group?
I'm not directly involved. My understanding it's a phase 3 clinical trial, so it follows the requirement for the trial. I think they have controlled. I'm not sure if they have the placebo, but it's do have a comparison group.
Now, you're a clinical epidemiologist. You have an enormous amount of experience looking at epidemics and now pandemics. What have been the surprises for you about this?
It's very hard to predict for this because in the early stage we saw that this is a very severe new epidemic, and if we look at severity, the mortality is not as high as SARS.
Yeah.
However, it's very contagious. So from Hubei, spreading to the rest of China only takes about a few weeks. So the spreading of virus very quickly. So our understanding of this coronavirus still another full answered question needed to scientific study to answer that.
Yeah, some people have suggested it's behaving more like certain strains of flu that have occurred in the past rather than coronavirus with SARS or MERS. It's been interesting. There's been a bit of discussion about that.
I think if you look at the transmission pattern, it looks like flu. However, the clinical symptoms are totally different. Some of the cases look like soon to be recovered. However, like just 1 day or 2 days, people died.
Yeah, so it's still... Go ahead.
The pathogenic of the virus is still a mystery.
Now, obviously, there's a great deal of interest about how coronavirus moved through different populations, from animals to human beings. Is there any additional information that's emerged about what the origins of this particular coronavirus may have been?
We do not have an answer yet. Virologists try to find the answer. So it is clearly the epidemic originated from the one of seafood wholesale market. So some of wild animal sold at that market. We do not know exactly which animal or which origin it comes from.
Now, obviously, the vast majority of cases have been in China, far less around the world, and that's despite a remarkable amount of travel between China and the rest of the world when it is likely that people were infected. So I've been impressed with what the public health communities and infectious disease individuals have done in countries around the world, including the United States, because it really has not spread substantially outside the U.S., except obviously for that ship in Japan. What do you think you would want to say to your other epidemiologists and clinicians around the world about how they should think about the infection? What advice would you give us?
I think if we look at the past few weeks, Chinese government takes strong action, particularly limit people move in out of Wuhan. That do slow down and reduce the epidemic and reduce the transmission from Hubei to the rest of the country, and also it reduce the spreading from China to the rest of the world. However, it's still some cases reported from neighboring countries, so the epidemic is without a border. So early detection is very important. So the surveillance program, the very sensitive surveillance to detect the initial cases and also immediately have the isolation control measures. It's very important to reduce the scare of the epidemic.
Well, I know obviously a great deal of information crosses my desk as well as I read extensively about this every morning and throughout the day. And I think you're well aware there's been concerns raised about whether quarantines are effective or not effective. And I'll let other people weigh in on that ultimately with respect to this epidemic and pandemic. But it's certainly an interesting question. And I know your government has been really quite aggressive about trying to really constrain the virus to a limited number of areas. Can you tell me what it's like? I mean, the numbers that we hear in the United States and around the world are remarkable, that China has constrained the travel of over 50 million people. That is a remarkable number. How has China been able to do that?
I think because of epidemic, send alert to the public, and also we do have lessons learned in the 2003 from SARS outbreak, and we understand isolation, quarantine. It's the most effective measures to control this epidemic. If we look at the epidemic outside of Hubei, so as long as they take this measurement, and the epidemic is mainly contained at a family or clustered in the family. So we look at all the cases outside of Hubei provinces. So cluster cases, family cluster cases, account for 83%. That means people, because for Spring Festival, they go return to home from Hubei. They brought virus to home. It's only transmitted within home, not beyond the home, not due to the community. So that means identify close contact and quarantine or isolate them. It's a good strategy to prevent the epidemic from a family cluster to the community.
Two questions have come in over social media, and I'll read them to you, or I'll paraphrase them. First, you mentioned the clinical trial that's ongoing. Have you had much contact with the different groups that have been trying to develop a vaccine? And do you have any information about vaccine development? There's, Dr. Fauci had mentioned that he thought in the best of all worlds we could get a vaccine into phase 1 trials in 3 to 6 months. Other people have said closer to a year. Do you have a sense about vaccines?
I do not know exactly how long it takes. To my knowledge, a few group of scientists are doing vaccine research. So optimistically, it may take about at least a few more months. So China, I think in the 2009, when the flu coming, it only took about 6 months to have the vaccine ready for vaccination. So optimistically, it may take about at least half a year to get a vaccine ready.
Right. Well, I'm guardedly optimistic that the epidemic and pandemic will be really much quieter in the next few months, and that ultimately we may decide we don't need the vaccine. Diagnosis in immunocompromised individuals is difficult because they may not respond to the PCR. Do you have a sense of diagnosis in individuals who are immunocompromised? I assume it would start with, what symptoms they have and do they have a good story for exposure to someone who was diagnosed. But do you have any advice about diagnosis in individuals who are immunocompromised?
We do not have the understanding about this issue yet. So because the epidemic just started a few weeks, so the study is still ongoing and we do not fully understand. So immunologists and virologists may have the study in this area.
Another question that's come up in social media, I'll read it to you, and it's again about the numbers that we had talked about earlier, that you had mentioned about 42,000 cases, 70% are in Hubei, and then another 21,000 where there's uncertainty. But the comment was an almost 50% increase in cases as of yesterday or today in Hubei province reports 14,840 new cases. Is this simply catching up? And they put that in quotes. Is this catching up as more testing is done? Can you comment on that?
That number also surprised me as well because previously we have accumulated cases waiting for diagnosis. And because for capacity to provide timely laboratory confirmed cases, it's very difficult. Then the clinician suggested, because in Hubei they just use clinical diagnosis cases.
Okay. And do you have enough diagnostic tests now? The CDC just sent quite a few out, and unfortunately there was a report that came across my desk very quickly that they had to recall some for different reasons. But does China have enough diagnostic tests at this point, or are you still behind in having sufficient amounts of tests to make diagnoses?
We do have sufficient diagnostic tests. However, it requires certain laboratory capacity and also need trained technician to perform the test.
And I think the world watched with amazement as China constructed 2 hospitals in a period of 2 weeks. I think most of the world just watched with amazement. It was remarkable. Is it your sense now that there's sufficient clinical facilities to care for individuals who need to be hospitalized or are seriously ill? Or is China still struggling with this new number of individuals who are so ill?
So China tries the best to make a treatment available for people suffering with coronavirus, and to new hospital build just less than 10 days. And also the local health authorities mobilize hotels and other facilities as a temporary healthcare setting, provide treatment for patients. Right now, I think the condition is going to improve.
This is Howard Bauchner, editor-in-chief of JAMA, and I've had a remarkable guest this morning, Zunyou Wu, who is the chief epidemiologist for China CDC. He's an adjunct professor of epidemiology at UCLA and the director of the Division of HIV Prevention at the China CDC, or obviously, as you can tell from this conversation, for the last 3 months, he's certainly been working on the coronavirus epidemic and pandemic. Zunyou, I can't thank you enough for joining me today. I know it's really quite late. I'm sure you've been working incredibly long hours. So I do want to thank you, and I really can't emphasize enough that on behalf of JAMA, the United States, I assume the world, that we wish you and your colleagues well in caring for these individuals. I have been impressed with what I've seen and read about the capacity for China to respond to this epidemic. So again, thank you so much for joining me today, and please stay healthy.
Thank you. It's my pleasure.
Right. I think we're done, Zunyou, but they need us to stay on for a few seconds.
No, that's fine.
Right. Zunyou, thank you.
Okay.
Thank you so much. I know it's really late there.